Uh, Good morning, ladies and gentlemen, President, office bearers, and senior members of the Indian Association of Occupational Health, and dignitaries on and off the dais. Uh, it's an honor and a pleasure to be here today and to follow someone so illustrious to talk about a mindful workplace, which is what I've chosen as a theme. It's customary to talk about the person in whom the oration has been named. And Professor Arjuna Das, I've known him since the time I was a child because he is my father's colleague and senior in Madras Medical College. He studied in Loyola, got his MBBS with many prizes from Madras Medical College, MD also from Madras Medical College, went to the Institute of Neurology in London to train in neurology, acquired his MRCP in 1956, and was the youngest person to be elected Fellow of the Royal College of Physicians. I think it's a record that's not been broken. He was 38. And in 1967, that would have been quite an honor because I don't think the Royal College was as easy as it is today in accommodating people. And a young Indian, quite an honor. So just we stand on the shoulders of giants, as Isaac Newton said. I think in all of us who follow Professor Arjuna Das have the greatest of regard, so it's a great honor. I wanted to flag up what has been in the news recently, which is the unfortunate passing of the Ernst & Young employee who was overworked. And it flags up for us a very, very interesting conundrum that we are facing today. On the one hand, there are traditional expectations that have been set into workplaces. And we've all been trained in those expectations and we all pass on that training to future generations of people. So you're supposed to go through a little bit of an Agni Pariksha when you join most professions. So when I think about when I went to train in neurology in the UK, it was nothing to do a 36-hour duty flat and then go sleep one night and then do another 36-hour duty the next 2 days. Nobody talked about European regulations on how much time you should work, or nobody said that you're overworked. It was expected that you would do what had to be done, and that was preparing you for the future. Now that's the mindset with which someone like me, who is progressively reaching senior citizenship, thinks. So I believe every doctor should be trained like that. Okay, and I presume I'll pass that on to my next generation who works with me. But we have a generation of people for whom the expectation may be very, very different. And how do you balance, therefore, your ability to empathize with young people in your organization with the resilience that you seek in them? Organizations and systems seek resilience. We expect resilience. How do you balance this is something that I think is a contemporary problem. And of course, what comes in the way is stress. Now, what is stress? It is a range of circumstances from ordinary workplace or familial dissonance to serious mental disturbances. Everything is colloquially called stress by us. But the most important thing, if you think about it, is the yawning gap between expectation and reality. So this young lady, one of the things that upset her and her family, as it came out later, was that the manager would expect her to finish things with the greatest deadlines, like I want this tonight or I want this by tomorrow morning, and he goes to watch a cricket match. Okay. So the expectation was that she would have some work-life balance, some personal time, some respect in the workplace and some fairness in the workplace. The reality was she wasn't getting possibly any of that. And that gap must have caused a lot of stress. So what happens to you when you're under stress? You feel tension, you feel pressure, you feel anxiety, you feel anger. But your body also responds to it. Your heart rate goes up, you have muscle tension, your bowel or your bladder becomes overactive, you have a sense of nervous energy. But although all of us experience stress, those of us who are sensitive worry more and are affected by it more. And God doesn't make all of us the same. Each one of us is different. So the same level of stress in a workplace can be very well tolerated by some and not very well tolerated by others. And obviously, in your profession of occupational health, making the difference between these two kinds of people is going to be extremely important, because the kind that is not tolerating it is needing to is needing a lot of support. Now, is it normal? It's common experience. It prepares the mind and body for danger. So if you really think about it, your fight, flight or freeze response is extremely important to you as a survival mechanism, right? And it's the same response that kicks in when a snake crawls into the room. It's the same response when you see your boss getting angry. Physiologically, it's the same thing that's happening within you. So it's important because it prepares you. Sir was saying, for example, that he had not thought about identification, but then he thought laterally out of the box and then presented an identification, and that saved him. Now that obviously is a response to stress. That would have been a very stressful situation when it was all going on. So it's normal to experience some stress, and actually if you think about it, stress is what helps you cope with situations. If you didn't feel that anticipation, to give you an example, if I just pulled out an old talk and turned up here, I will not be nearly as effective as if I really worked on my talk and put in new things that were relevant to you and familiarize myself. And that is a little bit of stress that, oh, I've got to give this talk, I need to take it seriously. Now, what happens to you when you experience stress? And this is a wonderful cartoon. If you see, the man sees the snake. Okay? Now, if you're a child, say under 3 years old, and you've not learned to recognize the snake as being dangerous, nothing happens. It's the same thing as anything else, right? But when a man sees a snake, the information goes to his visual cortex through his thalamus, and there is an outflow. The outflow is to your memory center, the hippocampus. You put a line through your ears. The hippocampus is on either side, size of a finger joint, right in the middle. But right next to it is your center for emotion, the amygdala. And the amygdala and hippocampus are neighbors. So your memory triggers emotion. When emotion is triggered, fear is the emotion that gets triggered. And it's that fear that leads to the autonomic outflow. And it's that autonomic outflow that makes you flee, stay and fight, or freeze. One of three things will happen to you when you experience that autonomic outflow. Now, imagine that that snake is the boss, and the boss's face that greets me in the morning about work that I have not completed the previous night, which was the expectation. My response is exactly the same, except that I can try to beat the snake or run away from it. I can do neither. I'm stuck in the room with the boss, and I'm trying to have to answer as to why something happened or why something did not happen. And that's the physiology is common, whether it's a snake or a boss. Pun intended. Okay. Now, when does stress become significant, needing our attention? When it leads to anxiety, when it leads to changes in mood, when it leads to restlessness, irritability, emotional unrest, or most commonly, physical symptoms that have no obvious physical cause. I have chest pain, I go to the ICU, an ECG is done, an echo is done. There's nothing wrong with you. Go away. Drop tea, everything is normal. You're fine. I'm having irritable bowels or chronic constipation. I see 3 gastroenterologists. I have scopes put into me in different directions. I have CTs. Nothing wrong with you. It's just stress. Go away. How often do we face this in our practice? Very, very often, right? So, and in Tamil Nadu, we have a very special acronym for this, the KKK syndrome or the Kai Kal Kodachal syndrome, which we routinely give tryptomer for it. You know, whoever turns up in the government hospital, the first thing we write is tryptomer. So that psychosomatic is an outcome of this autonomic outflow. Now, why does stress cause a physical symptom? Why do you not recognize it as stress? What Freud said was this, that when things stress you out, right, you bury it in your unconscious mind because you're still not prepared to face this information in your conscious mind. You sweep it under the carpet called the mind. So it's buried in your unconscious. Now, what happens when you keep on sweeping dust under the carpet? The dust will flow out at some point in time. And when it does, where does it go? It comes out as a physical symptom. You somatize it. It can come out as psychological symptoms as well. That can happen too. It's well known that people in non-Western cultures like ours tend to somatize. So we are more comfortable without realizing it, converting our stress into a physical symptom and talking about it rather than thinking of it as a psychological symptom. How many of us would go on Oprah Winfrey, for example, and talk about our lives? Not many, right? Because it's not the done thing in our culture. We don't go and bare our hearts to the whole world. That's not how we operate, right? We don't bare our hearts to our own family even. That's not how we operate. Oh, re talavaliya irukku, தூக்கமே வரல. Now I'm fine. Now I can talk about it, right? முதுகு வலி இருக்கு, கால் வலி இருக்கு, வயிறு கலக்கல் இருக்கு. I'm very comfortable talking about it. There is no problem. So somatization is not just India. Somatization is commoner in non-Western cultures. Research has shown that people from non-Western cultures who settle in the UK and the US, for example, also somatize because we kind of inherently, culturally, we have accepted that as a way of dealing with our stress. Now, what happens, therefore, we already talked about the physical symptoms, but I want to bring about this, that stress leads to hypertension. Stress leads to altered eating behavior, obesity. Stress leads to higher lipids and coronary heart disease. Stress leads to diabetes. So the acronym is HOLD. We had a conference, I think, some years ago about holding hold. Preventive health, actually, if you think about it, especially as we approach middle age, is about tackling these risk factors. And as our professor of surgery used to teach us, hurry, worry, and curry also are consequences of stress. They are also the consequence also is gastric ulcer or duodenal ulcer, extremely common in our environment, including our diet. Now, what is this autonomic that I'm talking about and how can you diagnose it? You have a sympathetic and a parasympathetic nervous system, and I'm just going back to show you, yes, I'm going back to show you that is connected with all your internal organs. Okay? Now, I want to give you one fact. I'm into integrative medicine, and many people poo-poo things like yoga. I don't know if you realize, raising the Kundalini is actually working on your autonomic nervous system. Our ancients figured this out long before the anatomy books were written. Right? A lot of what you do in yoga is controlling your autonomic nervous system. And this is something that we should celebrate as Indians, that we have that knowledge for centuries. So what happens when you have orthostatic hypotension? Man was never meant to stand up. We were expected to be apes walking like this. Then somewhere along the way, God said, stand up. So we stood up. And when we stood up, what happens to the blood? Follows gravity, goes to your feet. 5 liters of blood would have gone to your feet. Okay, you would have terribly swollen feet, right? Why does that not happen? You have a series of valves and pressor stimuli which are preventing that from happening. And that is also your autonomic nervous system. When it malfunctions, you get orthostatic hypotension, which is 20 millimeters of mercury systolic drop, 10 millimeters of mercury diastolic drop, and more. We get orthostatic hypotension. But there's something else we've recognized more recently. It's called the postural orthostatic tachycardia syndrome. Your heart rate races when you stand up by more than 30 beats. Okay? POTS, includes orthostatic hypotension, but the heart rate raising in my clinical practice and experience is far more common than classic orthostatic hypotension. And where do I see this? I see this in all my patients with long COVID symptoms. And all the patients whom we tend to call psychosomatic. It's all in your mind, it's psychosomatic. Why is it psychosomatic? The soma is reacting through the autonomic nervous system by being disturbed. And what proves that to you? It is doing the pulse and BP lying and standing in clinic 3 times. There are also a checklist of about 30 symptoms you can check out. I'm very happy to share that checklist with all of you. So it's so easy to do, but it leads to dizziness, visual disturbances. You can lose consciousness, you can have a syncope. It leads to cognitive deficits. Now, what's the headache that these people get? It's a dead giveaway. If you suspend a coat hanger behind my neck, the hook is right behind my neck, the stem is over my shoulder. That's my coat hanger headache with autonomic dysfunction. Doctor. That's where it pains. And that is something that it's almost a dead giveaway. And of course, they have oliguria, they have irritable bowels, and a range of other symptoms. This is fancy equipment that you can use to diagnose this. I do have a tilt table. It's not this kind of a fancy tilt table, but I do have a tilt table that I use for autonomic evaluations. But believe me, you can do this with lying and standing BP in your clinic. 3 times spread out by 5 minutes each. You will know whether your patient has got postural orthostatic tachycardia syndrome or not. And if they do have POTS along with their stress, then whatever you do to mitigate the psychological stress, the physical symptoms are not going to go away. You will have to work on the physical symptoms as well. This is extremely important for us to keep in mind. Okay, so stress has its genesis, if you think about it, in what is your inner urge and what is socially permissible. Freud sexualized a lot of things for which he has been criticized ad nauseum. He said that it was your sexual feeling towards a loved elder, your mother actually, which caused stress. That was one of his genesis of stress beliefs. But what that really is, if you think about it, it is a thought that is not socially permissible, which is what you sweep under that carpet of the mind. Okay? Now, take this young girl. This is a script from the letter her parents wrote. In her mind, she had qualified, she had got into one of the top 4 accounting firms in the country, in the world actually. Okay? The expectation would have been that you have to perform, and if you can't perform, there must be something wrong with you. That is the expectation with which, that's the weight of expectation that bears down on a young person. All right? So imagine, oh, I want to leave, is the instinct when things are not going well. What will people think? What will my family think? They've announced to the whole world that I've joined such a famous accounting firm, right? How will people react? Who will employ me again? Maybe this is how it will be everywhere. It's my first job. I have to cope. So what I'm trying to say is that your instinct may be to walk out, but the reality is that you are going to have all these thoughts going through your mind which question your instinct. And so you keep pushing yourself, as she did, believing that hard work and perseverance are the keys to success. But obviously, she was not able to cope with that level of stress. I mean, all this, of course, is coming from the press. We don't know actually what happened. But this is something that we need to think about, because young people in our workspaces are going through this. This is just highlighted to us what young people are going through. So what is all this? If you look at what happened after the World War, they set up factories. How many of you have seen Charlie Chaplin's Modern Times? Okay. So what would happen in modern times is that Charlie Chaplin will clock in and things will keep coming on that conveyor belt. And then the bell will ring and he'll go out and have his lunch. And then he'll come back and start again, right? So this conveyor belt was the start of what in psychology we call learned helplessness. What is learned helplessness? It comes from Skinner's experiments on mice. So you have a mice with two connecting cages. When you shock cage A predictably, the mice learns that he can go and sit in cage B and be safe. He does not get affected. When you start shocking both cages in an unpredictable fashion, the mice becomes depressed. Okay? So Skinner demonstrated in his behavioral experiments that depression comes when you have no control over your circumstances. And learned helplessness, therefore, is what the assembly line workers used to go through in the old days. Because I have no control. I can't even take a loo break. I can only take a break when the machine stops. Because it will come in front of me every, say, minute. And I'm supposed to do these three actions. If I don't do those three actions, that product will not be okay. So that was the way we set up manufacturing, and that is the learned helplessness. What is it today? It is people working on international time and people being connected constantly through digital media and the telephone. You're never really off work, right? So you may have this fancy job, you may be working for this international firm which is very renowned, but in reality you have a customer who is sitting in North America who is going to be demanding something when it's morning for him and night for you. When it's afternoon for him, it's way beyond midnight. And he's not going to say, oh, you can give this to me tomorrow. He's going to say, oh, I need this by 4 p.m. my time, right? And which, by the way, is going to be 2 a.m. your time or whatever. So this is the learned helplessness of the modern world. Okay. So which then brings us to, how do you stress-proof yourself? You stress-proof yourself when your locus of control is internal rather than external. What is an internal locus of control? When you feel in control of your circumstances. What is an external locus of control? When you feel other people, other things, a whole mechanism controls my circumstances. So people with an internal locus of control don't get stressed out. People with an external locus of control do get stressed out. Okay, now this is not always in your hands. You have to understand that the lower you are on the food chain, the more likely, at least in the workplace, the locus of control is going to be external. But beyond a certain point, middle management and thereafter, it's quite possible for people to shift the locus of control to being very internal. And as Professor Schanbach was eloquently putting it, that is actually entirely up to us. What we do, how we organize ourselves in our workspaces and how we work is what's going to determine that. But yes, younger people do have a challenge with this. Now, here is how we are intelligent. So, Howard Gardner from the Harvard School, a very famous psychologist, says, it's not whether you're intelligent, it is how you're intelligent. And not all of us are intelligent in the same ways. So he comes up with spatial intelligence, musical intelligence, logical reasoning intelligence, interpersonal intelligence. Professor was talking about how you need to negotiate with people and build relationships. Bodily kinesthetic intelligence, which is to do with movement and dance and sport. Linguistic intelligence, which is to do with languages. Intrapersonal intelligence, which is to do with an understanding of yourself. A naturalist intelligence, which is to do with geography, which is to do with outdoors, farming. So there are several types of intelligence. Now, what happens in a workspace? You're a square peg. You're driven into a round hole. You're expected to perform in a particular way. You're expected to perform a particular function for which you may not be entirely suited. And I think this is the challenge of the workplace. As an occupational health expert, when you have somebody in your organization who's struggling, one of the questions to ask yourself is this person really suited for their job? Do they have the attributes that are required in order to do this particular job? They may be perfectly good at doing some other job, but what about this job that I've given them? Can they do this job? And I think that is a question that we often have to ask ourselves. Now, what's the ultimate goal of human life? Maslow said it is to self-actualize. How do you self-actualize? In the first place, your physiological needs, roti, kapda and makan, have to be taken care of. If I don't have food, shelter and clothing, everything else is just philosophy, right? It's not going to help me. Once I've got that, then I need my security needs to be taken care of. I need my check on the first of the month. I need my salary. I need my home. I need a safe place to live with my family. I need to be able to meet my needs. Then what happens? That's when I start thinking about love and belonging and emotion and, do people love me? Do they respect me? I'm now ready to get married. All that comes only after I've met these level 2 of needs. Then comes that. Then comes, I want to be respected. I want to be valued. I want to be recognized. Those are my esteem needs. And finally, I self-actualize. Okay? Obviously, it's never linear that way. It's very interconnected, but these are the steps to self-actualization. But self-actualization is not just a pragmatic thing, it's a state of mind. So you can be self-actualized with very little, you can be not at all self-actualized with a lot. Okay, so it's not material at all, it is a mindset. But the thing to keep in mind here is your self-actualization today can disappear in a moment. Right? A phone call from your child telling you, Dad, I'm dropping out of university. I want to be a rock star is enough for all your self-actualization to disappear. Right? So it's very fragile, actually, if you think about it. Now, how do you cope with a stressful situation, therefore? There are two things you can do. You can modify the situation. You can make your boss behave. Right? The snake of a boss who wants to be in a cricket match while you do hard work. Okay? You can make him reset. How likely or possible is that to happen? Hardly at all. Right? So then what can you do? You learn to accept the situation and work your way around it. Right? So it's easier to modify your expectations than to modify the situation. My patients tell me very often, Doctor, 30 years I've been married to this man. Never has he wished me on my anniversary. Right? And deep down I'm thinking, after 30 years you're still expecting this guy to wish you? Not going to happen. Right? So it's about accepting. So the smart woman in that marriage, people like that, they tell me, oh doc, this guy is useless. He'll never get me anything. I'll go and buy myself and tell him. This is my happy anniversary to myself. Right? Now that's the smart way of coping with the same situation. That woman also has a husband who forgets to wish on anniversary day, but she knows how to cope with it. Right? So modify your expectation. Don't try always to modify the situation. What else can you do? Develop your social support systems. Very often, we all spend so much time working and put so much of our mind into work that we forget to invest in things that matter equally or more. Families, friendships, relationships. Because at the end of the day, work will give you a watch and send you home one day. They are not sending you anywhere, right? They're going to walk with you for the rest of your life. So you really need to be investing in them. And before you know it, they may not be available to you. So support is extremely important. Being part of social things is extremely important. Owning a pet can be very stress relieving. I spend an hour every morning with my 2 dogs. It's about the best thing I do. It prepares me for the day and relieves me of all stress. Okay? And then of course, today it's extremely important, and I think that as a group of occupational health experts, it's extremely important that you persuade your workplace to inbuild support systems. You need to create safe spaces. You need to create avenues. You need to give people opportunities to express themselves to someone so that things don't blow up without you knowing. Because at the end of the day, very often, you'll be the last one to know when something is going wrong. Okay? So, building this in, IIT, for example, has done this now over the last 10 years. IIT, as you know, has struggled with suicides over the years. But they've done this now over the last 10, 15 years. They've actually inbuilt support systems that involve other students, senior students, faculty members, and counselors, so that there is a layered and a tiered way of helping people, and somebody will catch and somebody will help. Okay? These are things that doctors tell everyone and don't do. Lead a healthy and predictable life. Good diet, exercise, adequate rest and sleep, scheduling and planning, delegation of duties and moderation in all that you do. I think most of us don't always follow all this. But these are things that we encourage everyone to consider and take up. So aerobic exercise, yoga, meditation, training, counseling, massage, other relieving measures, and religious and spiritual practices if you're so inclined. The thing to keep in mind, what does all the healthcare research tell you? 10,000 steps a day is most likely to give you good cardiovascular and good cerebrovascular health as well. 10,000 steps a day. In fact, a good friend of mine who's a very, very important strokes expert in the US, he says, I'm moving that now. I'm going to say 15,000. 10 is not good enough. Okay? But 10,000 is a good goal for most of us to keep in mind. And all you have to do actually is walk. And I think that's easy for most of us to do. Let's be aware of the warning signs of depression, low mood, helplessness, crying spells, not being able to sleep, thoughts of suicide, change in appetite. These are things that we need to keep in mind. Of course, there are several more that you need to be aware of. We are traditionally shy to talk about mental health. If someone comes and tells you, I'm feeling a bit anxious or a bit depressed, that our standard response is that, right? We do the same thing when people talk about a fear of death. I mean, when someone is diagnosed, say, with cancer, what am I scared of? I'm scared that I'm going to leave suddenly one day, and now this is right in front of me because I got a diagnosis, right? Our instinct is to rubbish it. Nothing will happen, man, you'll be fine. That's our instinct. We are actually not helping, right? To acknowledge that if I were in your shoes, I would feel this way too, is extremely important. To ask, why are you feeling that way, is extremely important. And young people are far less shy to talk about their mental health. We don't often enough ask them, how is your mood? And how are you feeling anxious? These questions need to become part of our everyday vocabulary in this day and age. Sometimes people get to the point like this young lady did, where you end up having a death wish. You can't take it anymore. Believe me, for a good proportion, it's an impulsive act, it's a moment. But for many others, it takes a lot of planning. And if only you caught them when they were still planning, you would have stopped something terrible from happening. So it's extremely important that we take every opportunity we can to help people not go to the point where they are starting to contemplate ending their lives. Now, is stress therefore necessary? Yes, some stress is important. It's what makes us perform. Too much is not. It's non-productive and wasteful, and therefore we need to build that fine balance of motivation and equanimity. We were having a huge discussion in our online group of alumni, all mental health professionals, nearly 300 of us, about this ENY incident. And many of us who are slightly older were of the view that this has got to do with the fact that we've somehow engendered a generation of people who don't have the resilience. We were thinking like that. But one younger colleague said this, and that's why I'm quoting it. She made a very important point. She said, I also think Modern life, with the need for working at odd hours thanks to IT advances and working on 24-hour timescales, has gradually eroded recognition and respect for basic rhythms of life, whether circadian or psychosocial, right? And I think that when we were growing up, when we were training, when I was doing those 36-hour duties, I could still go home and sleep. There was no cell phone, right? Once I went home, unless there was something very, very urgent and the landline was called, I was not accessible. Today, I am 24/7 accessible. And how do I react to it? I check my phone every few minutes, as if the world is going to collapse if I've not looked at my phone. All of us do it, right? So, in a sense, the younger generation, it's not just about resilience. We have landed them in a world which is in many other ways relentless. Okay, so what we have prepped ourselves to do and how we think they should be is further amplified by this very, very relentless world that they have landed in. And I think we need to be mindful of that when we think about them. So, what are the 5 steps? Recognize the genesis of your psychological conflict. Right? If something is preventing you from doing something, there is a conflict in your mind. Find out where that conflict is coming from. Develop your own coping strategies. If you can't modify the situation, modify your expectations. Regain your internal locus of control and learn to cherish it. One of the most important things I have done after the age of 45 is learning to say no. Learning to say no is far more difficult than learning to say yes, right? And the way I managed to balance my time is by learning to say no to a lot of things. So I'm not going to do that. I'm so sorry. Okay. This is so important. Work towards self-actualization. Remember, contentment and fulfillment do not necessarily require power or material gain. And I have one point to make here. Tell me what's the one predictor of human happiness. There is one single predictor of human happiness. Can someone tell me what it is? Starts with an A. Altruism. When you do things for other people selflessly, that is what is most likely to make you happy. It's not the Mercedes-Benz that you want to buy, or the Rolex you want to buy, or that international holiday that you want to go on. Those are not finally the things that make you happy. What makes you truly happy is altruism. The single strongest predictor of human happiness in science, proven in neuroscience, is altruism. And finally, we are all busy. We all tend to work very long days. You're here on a Sunday. Nurture and cherish your support systems. Your family, your friends, your relationships. Don't forget to do that, because at the end of the day, they're the ones who are going to walk with us in the long. So I leave you with this thought that there is always going to be this seesaw of employer empathy and employee resilience. The lower the empathy in the employer, the higher the resilience the employee is expected to have. But when employers raise their empathy a little bit and listen to their workforces, and Dr. Shanbag talked to us about good leadership, why it requires you to be interactive and empathetic. When you do that, your employee's resilience is not challenged as much. This is extremely important. Dr. C.V. Krishnaswamy gave me this quote, and I'd like to quote it. In illness, the physician is a father. In convalescence, a friend. When health is restored, he is a guardian. Professor Dr. Shanbag talked to us about preventive health. As purveyors of preventive health, you are the guardians of health. And I think I want to emphasize that particular part to you. I wrote about this in the Indian Express, an article called Atop the Healthcare Pyramid, why doctors need to be the ones making decisions and nobody else about healthcare. Many, many years ago. It's on LinkedIn as well if you want to look it up. And finally, my father, Dr. Srinivas, used to quote this all the time. Being happy is an attitude. Being stress-free is an attitude. Life is a pudding full of plums. Take it as it comes. So learning to absorb and accept what happens rather than constantly fight it in our minds is also extremely, extremely important. So I finish by saying, great honor to be here. It's wonderful to be able to speak in the Dr. Arjuna Das Oration in honor of Professor Arjuna Das. And I think we all stand on the shoulders of giants. And it's such a privilege, therefore, to stand on the shoulders of giants. Thank you so much.